Welcome to the HITea with Grace podcast, where we spill the tea on HITea. I'm thrilled to be here at the ViVE conference with Teri Thomas, CEO of Volpara Health. Thanks for joining me, Teri.
Thanks for having me, Grace.
Tell me a little bit about the career path that brought you to your role today.
Oh, gosh. I don't think I ever expected I would be a CEO, but from way back at my Apple IIe, I did really appreciate that technology has the potential to impact patients' lives and people's lives broadly. I also always loved healthcare. So I'm a registered nurse. I was pre-med way back in the day, thinking I was going to be a medical doctor. And I took what I thought was going to be a temporary job to save some money between getting my pre-med degree as an undergrad and bachelor's before starting med school, working for this company nobody'd ever heard of. It was named Epic. And they had this new thing, electronic medical records. The CEO asked me to come in for an interview, and I actually declined because I hadn't heard of the company. She sent me some information. I looked at it, and I thought, ooh, that's really important. Tracking medical records, it's so complex. And of course, people should use computers. I was quite interested, thought I would do it for 2 years. And then 20 years passed. So that was what got me into healthcare technology to begin with. Not my design, but became my love. And then going from Epic, I actually moved to the most beautiful place on earth, New Zealand. And that's where I live, at least part-time right now. And I was lucky enough to work for a wonderful company in New Zealand named Orion Health, and eventually found my way to Volpara, which is headquartered in Wellington, New Zealand.
So tell me a little about Volpara. What do you do there?
Volpara is on a mission to save families from cancer. We're very focused on breast cancer, but we also cover endometrial, ovarian, a number of other cancers. We do both managing the workflow when people go and get a mammogram. We assess people's risk of cancer, figuring out based on family history, based on when they had their first menstrual period. There are all kinds of factors that we can crunch together to figure out if somebody's at higher risk of cancer or not. And then we manage the workflow process, including even applying AI to figure out the likelihood that someone may have breast cancer looking at that mammogram. Volpara is now owned by a parent company, and I serve a role with Lunit as their chief business officer. And Lunit's a pure AI company. So they're about conquering cancer through AI. However, they do it a little bit differently. They've got both breast and a chest product, so they can analyze all different kinds of potential diagnoses from a chest x-ray, and they even go into the treatment part with digital pathology.
That is so inspiring, and I'm thrilled to be talking AI with you today. So tell me, AI has had a big year in 2024 into 2025, where we are now. Where do you see the most significant opportunities for AI to make an impact in the coming year and beyond?
It's funny, I was just on a panel with someone else who said, AI is the new UI. And I thought, oh my gosh, what a fun statement, because I do think that AI will become ubiquitous. And in some ways, it already is when you look at people leveraging ChatGPT and DeepSeek and their AI tools appearing everywhere. And so in terms of big opportunities, AI can do some things people can't do. Analyzing large amounts of data and finding patterns is something that people get tired, hungover, we miss things, but AI can be trained far more broadly than any person. So from the diagnosis space where I'm in, AI is becoming as strong as humans and in many cases stronger. I do think that will revolutionize how x-rays are read in the future. I think my kids are going to look back on this time and say, oh my gosh, Mom, I can't believe that people used to peer at those and try to figure it out, because it will be computers that are dominating it in the future. Do you inform people about when AI is being used? So if you're on a phone tree, if you're using a chat bot, do you know what's AI and what's a person? That line will begin to blur. And that's where it becomes important for us, the makers of AI, to be really clear and responsible and make it safe, because it will become part of almost everything that we do.
You lead a company focused on women's health, which has historically been underfunded, overlooked, and you're covering a very important topic here. This should not be happening. So what progress are you seeing across the industry in terms of supporting women and women's health? And are there any immediate areas you think need more focus and investment?
It's a great question. So my company, Volpara, focuses a lot on breast cancer. And I hate to say it, this sounds bad, but it's really sad that breast cancer has had so much visibility recently because of high-profile people being diagnosed with breast cancer. I do very much appreciate, and I have so much compassion for people who are going through a breast cancer diagnosis and treatment. And I applaud the people that are brave and stand up and share their experiences and raise visibility. And it's thanks to those brave women that have done things like the Density and Form Act that now women in the United States need to be notified of their breast density, which is a direct risk for breast cancer when they get a mammogram. And there's advocates out there. I will call out My Density Matters. There are so many women, mostly women, a few men here and there as well, who are advocating to make sure that when a woman gets a mammogram and found to have dense breasts, and they're told that they need to get a follow-on test because the mammogram can hide cancer in that case, or the mammogram will not show the cancer as well as the dense breast tissue. Cancer and dense breast tissue look quite similar. So they need to get either an MRI or an ultrasound. In 35 states, there are laws covering patients being able to get those follow-on tests, but that means there are 15 states that don't. So there are a number of people who are advocating for national coverage so that you don't have situations now where the law says you need to be told you have dense breasts, but there's no way for you to actually do anything with that information. So I think that's an area that we need to pay attention and invest more and empower women to do the right thing. 10 times the number of women that get breast cancer get heart disease. There is such a thing as breast arterial calcifications that can be seen on a mammogram, which are a marker for heart disease. Women often get heart attacks with symptoms that are very different from men. So if you ask the average person, what does it mean to have a heart attack? People will often say like crushing chest pain and sweaty and clammy and maybe some pain or tingling in the left arm. But those are the symptoms that men get, and a lot of women get completely different symptoms. Headache, upset stomach, there are all kinds of other things. So in terms of investing in awareness and things that will impact women, I actually want to see more education and more support with empowering women to understand their heart disease risk. I see that as a major opportunity.
Then how does that impact the work that you're doing every day and pushing forward this effort?
Yes. So we've partnered with a company called CureMetrics to be able to actually offer to our customers that information about their heart disease risk as a byproduct of a mammogram. And in breast cancer, of course, most of the research is done with women, but I would love to see more research with women in heart disease. And I think to do that, we actually have to actively recruit. We have to actively advocate for building that base of information about women. And I'm sad to say it, but right now, NIH funding is at risk. And so all I can say is for anyone listening to this podcast, please push to make sure that as funding goes down for a number of areas of research, that we don't forget about the women.
But in addition to research, what other regulations in the space really impact you? And it's something that you're tracking on a regular basis for your customers?
Anytime you're doing diagnostic AI, it needs to go through the FDA process. All of the indications are that the government regulatory oversight is likely to hold steady or even relax some of the regulations. But I actually believe that for vendors who are providing this technology, it's our responsibility to self-police. It's our responsibility to ensure that what we provide is safe. Somebody was asking, who owns the liability if somebody uses AI? Is it the provider? Is it the doctor? Is it the maker of the technology? Is it something with the workflow? And I say it's everyone, absolutely everyone. Just like in aerospace, you don't look at just one component and say, okay, you're the one responsible. Everyone needs to do the top quality for anything that impacts healthcare. And in areas that I think are particularly important are making sure that you not only create the processes to report and respond to any kind of adverse findings. So Volpara has a density disagreement process so that if we provide information that says this is a dense breast or not, and the provider sees it and they disagree, we've got a really strong process for them to be able to reach out. We can analyze it, we can compare it, we can figure out, was there something wrong? We can use it to learn and improve the safety of what we do. And I think those kinds of organizational processes need to be put in place for all of the makers of AI. That's a little hard because you want everyone to do the right thing, but not everyone will. So that's actually one of my worries when I hear that, oh, we may deregulate to support innovation. I'm okay with things proceeding in a straightforward way, reduce maybe some of the layers, but we have to make sure the basic safeguards remain so that we can compel people to do the right thing if you're in the pressure of profit versus delivery. So I do believe it's ethically important for us.
So important to think about. As you're thinking about 5-10 years down the road, where is AI going to have the most impact in the offerings that you?
Boy. As I mentioned earlier, I do think that we're going to see a trend where medical providers, doctors in particular, radiologists, they're going to be doing a smaller amount of more complex work, and the easy stuff is going to go to the computers. So we are going to see the concept of autonomous reading of mammograms and other X-ray images. And we've got technology right now to do normal filtering. If you imagine a mammogram as an image of a breast and tumors show up as basically white or light gray, dense tissue shows up as basically white or light gray as well. But as you go through and analyze that, maybe it's like looking across a field and you're looking to see, is that a weed? Is that a ball? What's in there? So being able to figure out both this field looks really clear, it looks really normal, and then maybe apply a second type of AI, which is what we do, also looking carefully for any abnormalities and then comparing the results. What's the normalness? What's the abnormalness? Does this look pretty safely normal? And eventually, the radiologists aren't even going to look at those. The things that are very reliably safe and normal will be screened away from the work so that the radiologist can actually focus their times on patient interactions, on more complicated analysis, and really what they were trained to do, which is taking on the tough stuff. I believe that's the direction that we're going to go in, and it applies to mammography, but it applies to a number of other areas in healthcare as well.
Amazing. So inspiring. And I'm just so thrilled that our listeners are getting to learn from you today. We love to hear about trends in the space, which you're amazing at, but we also love to learn about what drives women leaders in healthcare technology. So tell me a little bit about habits or things that you have implemented in your life and as a leader to help work your best to make a difference.
I do have a strong belief in fill your cup first. I myself do yoga and I spend a lot of time walking out in nature. I'm part of the 5 a.m. club. I generally wake up really early. I sleep a small amount, but very efficiently. I love my plug for the Oura Ring in terms of keeping track of my sleep. I think that women sometimes get into the situation of taking care of everyone else before themselves. I believe that you will be at your mental strongest if you are physically in good shape. You eat healthy, you exercise, you sleep, you take care of yourself, you get time to unplug. So I find that really important for me as a leader and to be able to show up as my best self for the rest of my team, but also to be an example to others. That I just had a situation where I was scheduling things. I travel really quite heavily, and I said, I've got some vacation time. I'll come back stronger and refreshed if I get that time out in nature. And I love that I can work with people and in an industry that people respect, prioritizing health. And so I think that's my number one. Take care of yourself, and then you'll take care of others better. You'll think better, and you'll also be a better role model for those around you.
Guys, she's giving you permission to fill your cup first, yes. Right? We have obstacles that come our way. They're expected, right? And as a leader, you are one that's experienced them and learned the art of resilience. So tell us, what are some strategies to remain resilient in the midst of obstacles that are about to come your way?
I think sometimes it's not what happens to you, but how you respond to what happens to you. That's the key to having a good life overall. When I look back on my life, the worst years I had where things didn't work out as expected, those were the years I learned the most. And if you can apply every curveball that comes your way as a learning experience, that's the key to resilience. So I do believe in the concept of productive discomfort. And I actually want my employees to live in a state of productive discomfort, which means you're always pushed a little bit, you're always stretched a little bit. If you get too comfortable, that's when your learning slows down. And in an industry like technology, where the pace of change is fast, my boss used to have a sign on her wall that said, "Move or get shot." If you don't create the ability to roll with what's coming your way, and if you don't see a crisis or a change as a learning opportunity, then you're going to lose an opportunity to grow. For me, resilience and being able to leverage all of these changes as ways to get to that next level is key. But I think it's also key for any culture that you drive in a technology company. If people are comfortable in technology, they will become obsolete.
I'm wondering, as a last kind of piece of advice, if you could talk to your younger self, what piece of advice would you give her?
I would tell my younger self to slow down a little and treat people with love and compassion. I actually tattooed on my arm a flower with the stem that has the word human. And it's a reminder to me that mostly we're trying our best. And I heard someone say this once, and it said, if you're exasperated, you're frustrated, you're impatient, maybe you're even angry, substitute the word human. There's such a human. We are all humans. And we all have good days and bad days and times that we're impatient, but most people, I really believe most people are generally trying their best. I went to nursing school after my 20 years at Epic, and I got my master's in nursing, and I took care of patients of all walks of life. I really enjoyed inpatient mental health. So I had the really crazy of the crazies. It required a lot of patience, but it also required a lot of compassion. And it was really powerful for me as a leader to re-enter leadership and the workforce with that mindset of treat every person with respect and compassion, because you don't know their journey.
I feel so honored to have met you, and I'm so grateful that you were so generous with your wisdom with me today. Thank you so much. Where can our listeners find you online?
Oh gosh, let's see. VolparaHealth.com and Lunit.io are the websites for the two companies that I work for. You can find me, Teri Thomas, and put together with Volpara or Lunit on LinkedIn. And I would say those are probably the best places.
Fantastic. Thank you so much for joining us today.
You're welcome.
Check out the HITea with Grace podcast for more interviews with great guests like Teri today. Cheers. Like a Girl Media is more than a media network. It's a community. We want to meet you and amplify your voice and the voices of outstanding women innovating in healthcare. Interested in starting your own podcast or hosting an event near you? Connect with us online or in person. We're here to support and empower you.